Welcome to the Perfect Dose podcast. We dive into everything you need to know about skincare treatments, wellness tips, and skincare routines so you can look and feel your best. If this sounds like you, make sure you hit subscribe so you can stay up to date on the latest episodes. I'm your host, Dr. Kristen Herzog, board-certified nurse practitioner and injection specialist. My med spa, The Perfect Dose, is located in Scottsdale, Arizona. If you are interested in becoming a patient and seeing me in practice, make sure you head straight to my website. If you're a medical provider and you want to stay up to date on the latest trends, techniques, have access to my protocols, articles, and business tips, make sure you follow me on Patreon at The Perfect Dose. For everyone else, follow me on Instagram and TikTok at The Perfect Dose. Hi, everyone. Welcome to the Perfect Dose podcast. I'm your host, Dr. Kristen Herzog, board-certified nurse practitioner and injection specialist. So today's episode is going to be really exciting because we're going to talk about how to rejuvenate the eyes without surgery. Now, this is something I think is probably my most frequently asked question. I get asked all of the time, what do I do for dark circles under my eyes? What do I do for lines around my eyes? My skin is sagging. My eyes look hollow. I feel older. I look tired. All of these things. I am getting asked in office, what can I do to treat these concerns? So we're going to break it down for you guys, all of the treatment options that don't include surgery. So today is the non-surgical rejuvenation for your eyes. So the first thing that we need to understand is the why. What is the root cause of the problem? Are you experiencing under eye hollowing due to volume loss? Are you experiencing under eye hollowing and lines around your eyes due to skin laxity problems? Or are you seeing dark circles because you have some volume loss, some pigment issues, some skin laxity? So like a combination of all three. Or do you have an actual hyperpigmentation issue underneath your eyes that is genetic, and that's why you are seeing under eye circles? So number one, we need to determine the cause. We also need to understand what's happening with the eye. And I like to explain this because it's important to understand as we age, our skin loses firmness and elasticity, and this happens globally. But we tend to see our aging more around the eyes, and that's because the area around our eyes is thinner. So the skin around our eyes is much thinner, and we experience mechanical trauma to this area on a daily basis, you guys. We wake up in the morning, we rub our eyes, we put on our makeup, take off our makeup. All of these things are contributing to mechanical trauma in an already thin and delicate area. So people tend to see aging in this area a lot more prominently and a lot more rapidly than they do in other areas. So that's important to understand. Now let's really get into the root causes and what we can do for each root cause. First, let's talk about under eye hollowing. So if you have under eye hollowing, which means hollowing underneath the eyes, your skin is really tight, you truly just have volume loss, you could be a candidate for under eye filler. Now, I say that because it is very rare to actually be a candidate for under eye filler. In fact, 9 out of 10 people are not candidates. What's happening around the eye is we have these two ligaments that are very important. So we have a orbital retaining ligament and a zygomatic cutaneous ligament. And think of these as like the hammocks that support the eye. If we lift and support the hammocks, most people, 90% of people, will get full correction. So typically we can address this area with filler in the mid-face before we even address anything in the actual under eye. So first we need to add filler in the mid-face to lift and support the ligaments beneath the eye, and most people get great correction. So if you're having hollowing underneath your eyes, first try some mid-face filler before you consider under eye filler. Because again, most people are not true candidates for under eye filler. If you have issues with allergies, if you have any of the other problems that we talked about earlier, like skin laxity issues, you are not going to be a good candidate for under eye filler. And what can happen is if you get under eye filler, it will look really, really good temporarily. And then 5 years down the road, it's going to look puffy and weird because you weren't a candidate. So some people are good candidates, and to know if you're a good candidate, you need to make sure that you have good skin elasticity. So making sure that skin is firm and tight. You can do a little pinch test. If you pinch the skin underneath your eyes and let it go and it bounces back right away, most likely your skin is firm and tight, and you could be an under eye filler candidate if you don't have any allergies or other history that is going to make you not a candidate. However, If you pinch that skin and it stays and doesn't bounce back right away, you have a skin laxity issue and are not a candidate for under eye filler. So, what do you do if you have hollowing under your eyes and you're not a candidate for filler? The next thing we can do, and this is actually my preferred method, you guys, under eye filler is not my go to. And that's just because, again, most people are not true candidates for this. So, my go to is going to be the filler alternative, which is a biologic. And there's a few things that people are doing right now that actually look freaking amazing. So, number one is PRF Easy Gel. And this is going to be where we draw your blood and we spin it down in this centrifuge. And the centrifuge is going to separate your platelet rich fibrin from your plasma. And the platelet rich fibrin is going to have all of the good stuff, your growth factors, the proteins, things that are going to make your skin thicker and healthier so that we can add more volume in the areas that we're treating. Now, the benefits of this is it's your own, so you're not going to have any issues with it. The con is that we don't know the quality of your growth factors. So typically when I treat patients that are like in their 20s, PRF Easy Gel looks absolutely amazing. If you're in your 30s or more, you may not get the same results because lifestyle factors, age are going to decline your growth factors. So things like alcohol, sun exposure, any autoimmune issues, and just aging in general will decrease your growth factors. So I prefer something that's a little bit more controlled when it comes to patients that are 30s and above when treating under eye hollowing, and that is PDGF. PDGF is platelet-derived growth factor. So essentially, all of the things that we love in PRF, when we draw our own blood, we spin it down and inject it into the skin, we are basically doing the same thing, but we're creating the platelet-derived growth factors in a lab. So we know exactly how many growth factors are in each treatment. And when we do PDGF, you will get about 300,000 times the amount of growth factors than you will with traditional PRF. So I've just seen really, really amazing results with this. I love to do this for my patients. That is my go-to. If you have hollowing underneath your eyes, the first thing we need to do is address the mid-face with fillers. We need to support the hammock. Then the next thing that we need to do is actually treat the under eye hollowing. And I prefer to do that with PRF Easy Gel or PDGF on most people. But again, you may be a candidate for under eye filler. And if you are, that can be a really great option as well. So what if you have skin laxity? So when we're talking about pinching the skin and it not quite going back to normal as quickly, or you're noticing that you have lots of fine lines underneath your skin, then you have a skin laxity issue. And what we need to do if you have a skin laxity issue is tighten the skin. So this is when the lasers are going to come into play. I really love a CO2 laser in this area. CO2 laser is my go-to. It is going to ablate the first layer of your skin. So it's literally going to take off that first layer. And with this amount of heat, you will get a really great tightening effect. So this is my go-to. This is a before and after, so you guys can see how impactful this treatment can be. Now, the only con to this is downtime. There is going to be some downtime to this procedure, but the results are incredible and it is non-surgical. So what if you have pigment underneath your eyes? Well, if you have pigment underneath your eyes, you need to address the why. Is it pigment because of hollowing? If it's pigment because of hollowing, then the first part of what we talked about is going to be applicable to you. Now, if it is pigment due to hyperpigmentation or genetics, so if you pinch the skin underneath your eye and the darkness goes away, then it's due to volume loss. If you pinch the skin underneath your eye and the darkness stays, it is due to hyperpigmentation. So we're going to need to treat the pigment. What we do for this, number one gold standard is going to be hydroquinone. That is a prescription strength skin lightener. Now, it's going to be a little bit more aggressive, so you're going to experience some redness, some dryness, some flakiness, and you have to be careful in the sun. That's the only con to this. Other alternatives are going to be vitamin C. I love using a vitamin C serum underneath the eye. I feel like vitamin C is such an underrated skincare product. Not only does it help treat pigment in the skin, you also can utilize it for protecting and preventing against UV damage. It's also really important for collagen stimulation. So many benefits. It's an antioxidant for your skin. You need to be using this not only underneath your eyes, but all over your face. I do this myself, and I'm telling you guys, it is one of my number one hacks. So to wrap up, if you want to rejuvenate your eyes without surgery, you need to first address the root cause. Is it skin laxity? Is it under eye hollowing? Or is it pigment? And then you can treat accordingly. If you're listening to this episode and you haven't purchased a vitamin C serum, you need to purchase that now. I'm actually going to provide you guys with a discount code here so you can save 20% off of your vitamin C order. Thanks for tuning into today's episode. I will see you guys next week.